So thanks everybody for coming out. We just wanted to give some context to the current situation and to today's numbers. As you've already seen, we have 2,270 cases in Orleans Parish and 115 deaths. Those are significant increases from yesterday. I want to make it clear, we are at the beginning of the wave, of the surge, and that we should not be looking at what happens day to day to change the behavior. The stay-at-home order that was put into place 2 weeks ago, we've seen people doing a really great job complying with that. We will not know the effects of that for another week or two or even more. So if everyone is looking at the numbers day by day and thinking that they're going to see what the real trend is, that's not going to happen. There's a lot of reasons why cases go up more on one day than another. A lot of why we're seeing a big increase today, and a lot of why we expect to see a big increase in the next coming days, are that, number one, we've expanded testing, which is a really good thing. Number two, we've had a backlog of commercial tests, particularly with our drive-through stations, that we're still waiting on several thousand results. We anticipate that those results might come all at once, and when that happens, we're going to see a huge increase in cases. But understand, those were tests that might have been done 7 or 10 days ago. So they're not necessarily reflecting exactly what's happening today. I want to continue, and we're all continuing to really hammer why it is so important to stay at home unless you have essential business to do. And that's because that this is a lethal virus. This is a deadly virus. We have right now in Orleans Parish 115 of our residents who have died from COVID-19. That is about as big of a number as we had homicides last year. This virus is deadlier than a bullet, and everybody needs to have the same level of concern as they would about that. Right now, what we're seeing, of those that we have positive tests for, so of those known cases in Orleans Parish, 5% of them result in death. That means that 1 out of every 20 people that have been diagnosed with this virus so far will die. That's why it's all up to all of us. We don't want to be the one who results in that 1 in 20 dying, or someone in a hospital bed, or someone in a ventilator. So that's why I'm asking folks, please, it's absolutely important to get the information. The Louisiana Department of Health is doing a fantastic job of keeping us all informed with numbers and statistics, and they are really helpful as we plan our next steps. But we need to continue what we're doing regardless of the number of cases day to day. That's kind of all I had on that, but I'm happy to take questions or clarify.
Sure.
Dr. Avegno, the governor mentioned that in Orleans and Jefferson there was indication that the curve is flattening. Do you agree with that? Why or why not?
I think it's too early to tell. I think, there's a lot of measures out there that we look at. I think we can definitely say that we know people's behavior has changed, and what we know and what all the experts are telling us is that the only way to flatten the curve is to change behavior, is social distancing, good hand hygiene, not going out except for essential needs. So again, there are some very tiny glimmers of hope, but I don't think our curve is going to flatten anytime in the near future.
Jeff, you got it?
Do you have any sense how old the tests that came in over the last 2 days or couple of days are? Is there a way of comparing what the average?
Yeah, that's a great question, because it really, that's something we all want to know. In terms of the tests that came back today, I don't necessarily know how old. I can tell you that we've spent a lot of time looking at our drive-through lab testing, and to date, between the Orleans and Jefferson sites, we've tested over 8,000 people. Of those, particularly with the Orleans sites where LabCorp is processing those tests, we are missing several thousand tests starting with March 20th. So there is a lot of tests that were done a week or 10 days or more that we don't have results yet. That's something that we've elevated to the highest levels at LabCorp. We don't have a satisfactory answer. That's part of the reason why the health department stood up a call center to talk to residents about wanting to know what their results are. But I suspect that there are a good number of tests that are at least 7 to 10 days old.
Sure. If you could maybe stress to the public again, something that you've been talking about the last couple of weeks, how healthcare workers are at risk. We will see the ramifications of that.
Yeah, absolutely. You know, I'm an ER doctor by training. I still go to the ERs. Our frontline workers every day are putting their life at risk. We've seen across the country that healthcare workers who are previously healthy are dying of this because again and again they are caring for so many patients. You know, we are in close communication with our hospitals to make sure that they have adequate PPE to be able to safely care for patients and take care of themselves. But just think about that. Think about all the people in your life who are a nurse or an EKG tech or a housekeeper at a hospital or who work at a healthcare facility. When you go out, think, is what I'm about to do worth putting their life at risk? Because we really, just as we need to protect our vulnerable and those at risk of dying, we need to protect our healthcare workers as well.
Have you all begun seeing any of the PPE gear that was being offered by the government that they were shipping? Has that started getting to local hospitals?
Yes, I think Colin described it best when he says it's coming in dribs and drabs. I know that LCMC got a big shipment a couple of days ago. I know the hospitals continue to get shipments in. We are very, very grateful for the donations that have been coming in for the PPE drive, both from our residents and from Lowe's just yesterday. But it's really not coming at in the speed and volume at which we could feel very comfortable that we would be good for a considerable amount of time.
Do you know how we're doing locally for respirators? Do you have...
I do. We're holding our own. All of the hospital systems have really been figuring out ways to expand their ICU capacity, whether it's taking over unused parts of buildings or wings, or converting various parts of the hospital. They've really been strategic about getting every single ventilator that they can. I believe I heard the governor say earlier today that 150 that he was promised should be on the way. Then that's Louisiana. I do imagine many of those will come to Region 1. Our hospital, our doctors, our critical care doctors, I can't say enough about how smart and evidence-based they're really being about giving folks the absolute best treatment on vents, and healing them in some cases better and faster than has been reported elsewhere. So everybody from doctors to the frontline personnel on down are doing their best to stretch out the number of vents. So far it's been holding, but we're waiting for that potentially mid-April day when it doesn't.
Do you know how the convention center is coming along?
Yeah, it's coming along great. It's really quite an operation to see. They are on target to start accepting patients through the weekend, is what I'm being told. We had a call with hospitals, all the hospitals in the region, to make sure they understood the criteria, to answer their questions, and to make sure the process, once it's open and ready to go, will be as seamless as possible. So yeah, they're right on target.
Thank you. Drove through Lafreniere Park in the lakefront, and there were an awful lot of people out there. It did seem like they were keeping their distance. A lot of people out there by themselves, walking, hiking. Do you still support that, or do you want them to just stay home?
So we all understand the value that exercise and getting out in the fresh air can play during this time. People have to have a place to, or some way to exercise, blow off steam. And as you said, most people are doing it safely. If you're walking by yourself or with your immediate family, and you are 6-8 feet away from the nearest person and you're not having a big group party, then that's fairly safe. And I think that, you know, the benefit to doing that probably outweighs the risk in most cases. But it's interesting, what it seems like is that most of the calls that we're getting to report gatherings are at parks. And so, you know, you can go out, but it really should just be you or you and your close family members. It shouldn't be meeting up with your friends. It shouldn't be a way to connect with that person that you work with that you haven't seen in a couple of weeks. It should be you and your immediate family. One of the things that we're going to start doing, you know, we certainly are going to keep up the enforcement. We're going to start doing some different messaging, and we're going to be putting together yard signs and signs to put in public places like park, just to serve as a reminder, 6 feet away, playground equipment is closed, you know, please be out and you know, let off some steam, but you've got to do it within certain parameters.
All right, we got time for one more question for Mike.
Thank you.
Thank y'all very
Good.
much.
I'm sorry.
You had a question?
Oh, yeah, one more if you got it.
So sort of a compound question. One, I wonder if you could sort of directly address any concerns you have about how long it takes for the test to come in and what that's doing to hamper your response around. But also, you mentioned it's going to be a week or more before we sort of see the effects. I wonder if you could say that based on the test or just what we know epidemiologically about health process.
Yeah, good questions. It gives me great concern and great frustration that our residents who are ill and anxious and quarantined at home and who, you know, were able to use this service to get a test are not getting their results. I really am quite upset about it. We all are. And we have been as I said, we have been pushing LabCorp in particular for days to explain this. We know what a challenging time this is, and to add to that anxiety is just unconscionable. That's why at least what we can do now is be that local voice for residents who are looking for their test results, to call us and at least talk to somebody, right? You know, the messaging is really the same. If you feel like you were sick a week ago with COVID symptoms, you should just assume you have it. And if you're 2 weeks out and you've been feeling fine for a couple of days, you can assume you're safe to go back. But we really would like to give people a little more peace of mind. In terms of when we see effects, you know, it would be really easy to say, okay, we did a stay-at-home mandate on this day and everybody complied with it 100% on that day. But we know that that's not true. We know it takes some time for behaviors to change. We've done a fantastic job in a very, very short period of time changing our behavior, but there's still some lag time. And so really the only places we can look to kind of get a guesstimate of how long one has to stay at home are places like Italy, South Korea, China. You know, Italy has been under lockdown for a good 4 weeks. Far more severe than what the stay-at-home orders in the U.S. are, and they're, after 4 weeks, just starting to see a decrease in their cases, and again, we don't even know if that's sustained. So it's for epidemiologic reason, and it's just for the virus. Once you contract the virus, it might be a couple of days to show symptoms. You might have symptoms for a couple of days. If you get worse, you go into a hospital. If you're put on a ventilator, most people are staying on a ventilator for 10, 15 days. So it's a very long course. And that's why we know that we have to wait a very long time before we can say that the curve is flattening.
Thank you, Doctor. Thank y'all very much.
Thank you, guys.